I'm Dr.GarimaAsati. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic cervical spondylosis in English on the demand of few of my non-Hindi patients. So let's continue with the topic cervical spondylosis. It is one of the most important cause of neck pain. Here, in this cervical spondylosis, there is degeneration of spinal cord takes place. So there is wear and tear takes place in this cervical spondylosis. While in cervical spondylitis, there is inflammation of the vertebral column. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe my channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, because in the last I am going to explain you some of the medicines which can be helpful in curing the cervical spondylosis. Now let's talk about the symptoms of the cervical spondylosis. So it causes severe pain, especially in the neck region, shoulder, back or upper arms. So the pain may be mild to moderate or may be severe or excruciating. It also causes paresthesia of one side or even of both sides of the arms. It also causes muscular weakness and it may lead to dropping of things from the hands due to muscular weakness. There may be sensory and motor disturbances, and there may be compression of the spinal nerves because of the narrowing of the two vertebrae. The two vertebrae gets narrowed, the gap between those two vertebrae becomes narrower and it leads to compression of the spinal nerves, which can lead to paresthesia or severe or excruciating pain. Now, types of spondylosis. So, it may be cervical spondylosis or lumbar spondylosis. The cervical spondylosis causes pain in the region of the neck, upper part of the back, shoulder and arms, while lumbar spondylosis causes pain in the region of the lower part of the back, thighs and lower limbs. In cervical spondylosis, there is paresthesia of the hand. There may be balance disturbance because cerebellum gets affected, the neck region gets affected. So there may be disbalance or imbalance seen in the walking because of cerebellar affection. In lumbar spondylosis, there is gait dysfunction, that is dysfunctioning in the walking, and there may be loss of control in bowel or bladder movements. There may be paresthesia of the legs. Now let's talk about the causes of this cervical spondylosis. So it can be age related, and other causes are more forward bending, poor posture of sitting and constant abnormal pressure on the neck, and due to sports or any injury if occurred during sports can also lead to the cervical spondylosis. Now let's talk about the diagnosis of this cervical spondylosis. So digital X-ray, CT scan, MRI can be helpful in diagnosing the cervical spondylosis. Now friends, I would like to tell you about the homeopathic cause of this cervical spondylosis. One of my cured case of cervical spondylosis with the homeopathy and some of the homeopathic medicines which can be helpful in curing the cervical spondylosis. So the homeopathic cause of this cervical spondylosis is there may be some loss of esteem or dignity in the life which can lead to this spondylosis. So the person has to bend in front of someone, that may lead to this cervical spondylosis. Now I'm going to just tell you about one of my cured case homeopathically of this cervical spondylosis. A patient aged 35 years having pain in the neck region which has been radiated up to shoulder and the whole arm up to fingers even and to the back region. The digital X-rays show C3-C4 fusion of the vertebrae. An incident has occurred that she has been fired from the job, but her husband was still on work. Even after that, she was continuously thinking that her family will starve. She was very sensitive to rudeness. She is very sensitive to what others say about her. There is a suppressed anger, throws things at others in anger especially. Too dignified to fight. The rubric taken was delusion, family will starve, and the medicine given was Stephisagria 200, which cured her completely within 6 to 7 months period of time. Now I would like to tell you about some of the homeopathic medicines which can be helpful in curing the cervical spondylosis. So the first medicine is Veratrum album. So the patient is having radiating pain from the neck region up to the sacrum, and it gets aggravated after a stool. Cramping sensation in the neck region. Things get whirled around, and there is vertigo, especially in opium eaters, and continuous vertigo due to this neck pain or cervical spondylosis. The mental generals of this Veratrum album is patient is too much religious but having show of tendency, and there is a slendering disposition in him, very haughty and egoistic person, want to be high esteemed and want to be a very social and high society person too. So if these symptoms correspond, Veratrum album can be helpful in curing this cervical spondylosis. Next medicine is Aurum metallicum. So there is vertigo on stooping, and person feels that as if he is turning in a circle, and there is aggravation on raising head as if he is drunk. So their raising head causes more vertigo, and there is pain in the neck region, and along with that, stooping always aggravate all the complaints of this Aurum metallicum. There is swollen cervical glands and tension in neck as if muscles were too short, which get aggravated even after rest. The mental symptoms of this Aurum metallicum is there is disgust of life, suicidal thoughts, forsaken feeling, but person is duty-bounded, workaholic, industrious, and oversensitive to contradiction, having a very positive attitude like metal. So, if these symptoms correspond, Aurum metallicum will be helpful in curing the cervical spondylosis. That's all about this topic. We'll meet soon with a new topic, new subject in the next video. The clinic address of mine and the contact number is given in the description link. And it's my humble request, kindly don't take any medicine without consulting doctor. Stay connected to stay healthy. Thank you.